dito? May nawawalan ba ng ID o ano? Pagod na ako. Kailangan ko muna magpahinga. Sakit ng ulo ko. Di kasi ako kumain kanina eh. Ma, alam kong di mo alam na may part-time job ako. At siguro, mas mabuti na yon. Paraan ko kasi yun para matulungan ka. Matulungan tayo. Sana maintindihan mo. Di ako susuko. Patuloy akong mag-aaral at magtatrabaho para magkaroon tayo ng magandang buhay.
Hey girls, wanna hang out today?
I'm at the cafe right now. What's the matter?
About that, how about we go to cafe? My treat.
Oh, my dad said we can borrow the private jet today. I guess we'll use it next time.
Yeah, I'm not in the mood to go overseas today.
So do I. I have too many appointments to attend to.
Well then, it is settled. I'll be at cafe at 10 a.m. Catch you guys there.
Bye! Thank you, miss.
I think we should get the bill now.
Are you sure you're going to pay?
Marga!
Are you for real? But you know what? I'll forgive you because your dad is a mistake. Waiter. What is this? COV? Does that mean something?
Hey, what's the matter?
I think I should go. I'm just gonna go somewhere.
Oh!
Ah! Aren't you looking at where you're going? The path is wide enough for the both of us. Look what you did. Now, my outfit is dirty. Don't you know how expensive this is?
Sorry, hindi ko kasi sinasadyang bungkuin ka. Eh, may tinitingnan kasi ako eh.
That's why. You really wanted to push me like that, didn't you?
Hindi. Hindi nga. COVID? Oh, may lumabas na portal. Tara, pumasok tayo. Tara na.
COVID-19 is named as coronavirus 2019. It is a lethal respiratory syndrome that SARS-CoV-2 causes. We pronounce it as severe acute respiratory syndrome coronavirus 2. It first originated in Wuhan, which is a city in China. It spreads due to eating bat meat, and the first case was identified in December of 2019. Now it is a global disease and spreads all over the world. Coronavirus has various RNA mutations. That is why the world is facing so many issues while developing its vaccine. Immunodeficient people, like older people, are more likely to be the victims of COVID-19. Its symptoms appear in victims after 14 days after the attack of the virus, and they can vary from mild to severe depending upon the immunity of the person and the type of mutation. Causes of COVID-19. Severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, is the leading and only cause of COVID-19. It is a transmittable pandemic. Its strains are transferred from the infected person to the healthy person through the air when they inhale the infected person's airborne particles. These virus-containing particles come into the air when the infected person talks, coughs, or sneezes. Touching the area where the virus-containing particles are present also causes COVID-19. It is not penetrable through the skin, but touching the eyes, mouth, or nose can serve as a pathway for virus entry into the body. There are rare cases where viruses transfer from mother to child during pregnancy. Signs and symptoms of COVID-19. Symptoms of COVID-19 vary from person to person. The higher the immunity, the lesser the chances one has to become infected with COVID-19. Most people first develop mild coughing after being infected at the start, leading to moderate symptoms. If we do not treat it properly and avoid proper medication, it leads to complicated symptoms that are hard to treat and may lead to destructive impacts. Symptoms are as follows. 1. Fever and cough. 2. Pulmonary fibrosis. 3. Pneumonia. 4. Fatigue. 5. Kidney and respiratory tract failure. 6. Shortness of breath. 7. Cytokine release syndrome. 8. Loss of smell or taste. 9. Pediatric multisystem inflammatory syndrome. 10. Viral sepsis. Diagnosis of COVID-19. Reverse transcriptase polymerase chain reaction and nucleic acid testing are done on infected secretion in the laboratory, diagnosing COVID-19. A CT scan of the chest can also be helpful to diagnose it. We detect body antibodies by serum testing, which can diagnose the antibodies produced against the virus. The nucleic acid test in laboratory testing is the most reliable method to detect viral RNA. We do a nasopharyngeal swab to obtain respiratory samples. Then a test is conducted on that sample, and we obtain results within a few hours. We also do a CT scan to analyze the lung condition. Conditions like multilobar and subpleural dominance, pleural effusions, and filling and spacing of alveoli may occur as the disease progresses. So, computed tomography or chest radiography can occur, and by analyzing the condition of the lungs, we can diagnose COVID-19. Prevention and treatment of COVID-19. Preventive measures like social distancing, staying at home, avoiding social contacts can prevent it. Wearing masks while going out, using alcohol-based sanitizers, washing hands with soap can also prevent the transmission of the virus. To prevent COVID-19, touching the face, eyes, and mouth must not be done. Those people exposed to the virus are advised to self-quarantine in their houses or visit medical centers when needed. They must isolate themselves from their family and avoid using everyday household items. They must take proper medication. Cover their face with a tissue while sneezing or coughing. We must administer the COVID-19 vaccine without wasting time.
Managing COVID at home has two aspects. One is treatment and care of the person with COVID, and the other is to take the right safety measures to protect others from getting COVID. You should start following these steps as soon as you develop any symptoms or if you had a positive COVID test, even if you don't have symptoms.
Dr. R., how should someone with COVID take care at home?
The symptoms of COVID and their severity may be different from one person to another. In most people, COVID can be managed at home, but you need to watch out for signs of serious problems. The risk of severe illness and hospital admission is 10 times higher in those who are not vaccinated compared to those who are fully vaccinated. For treatment and monitoring, here are some things you should do. Take good rest and keep yourself well hydrated. You can take hot drinks such as water with honey, soup, or tea. For body aches and fever, use 1 or 2 tablets or Tylenol or Panadol as needed. Usually, severe body aches and fever will start getting better after 2 to 3 days. If you have other symptoms like cough, stuffy nose, or throat irritation, you can use cough medicines or anti-allergy medicines as well. Monitor your temperature and your breathing 2 times each day. If you have a pulse oximeter at home, use it to measure oxygen levels. Using supplements like vitamin D and vitamin C may be helpful in some people, but are not needed for everyone. It is important to know that antibiotics are not helpful in COVID or other viral infections. In some people with weak immunity and a high risk of COVID getting worse, doctors may prescribe special medicines. Additional medicines are only needed for those who have severe illness and those who have breathing trouble requiring extra oxygen. In certain situations, you should seek medical help by going to a clinic or hospital. Let them know you may have COVID. Here are some reasons to seek help urgently. If you have trouble breathing or are having lower oxygen levels below 94%, having persistent pain or pressure in the chest, having bluish color of lips or nails, or getting drowsy, confused, or losing consciousness.
Dr. R., what safety precautions should patients and family members take at home?
Proper home isolation is very important to stop infection from spreading. If you have COVID, stay home for at least 5 days, even if you have mild symptoms or no symptoms. Leave the house only for necessary medical care. After 5 days, if your fever is resolved and your other symptoms are almost gone, then you may leave your house as needed, as long as you cover your nose and mouth with a mask. Keep using a mask for the next 5 days and minimize close interactions with others. After 10 total days, you can interact with others like before. If your symptoms and fever continue, then stay home for the whole 10 days as much as possible. Here are some tips for you and your family for home isolation. The person with COVID should stay in a separate room. Others should avoid coming in this room. If they need to come, then they should cover their nose and mouth with a mask or cloth. You don't have to wear a mask when you're in the room by yourself. Each time you leave this room, then cover your nose and mouth with the mask or cloth and keep a distance of 6 feet from others. If you live in a single-room home or getting a separate room is not possible, then isolate yourself in one side and keep a 6-foot distance from others. You can use a curtain or a sheet to stay separated. Open windows for good air circulation. When others are in the room, keep your nose and mouth covered with a mask or a cloth. If possible, use a separate bathroom from others. If there is only one bathroom for everyone, then keep its window open for air circulation, and everyone should wash their hands with soap and water after using the bathroom. Do not share cups, utensils, towels, pillows, bed sheets, and other items of daily use with others. Remember, soap kills coronavirus, so it is okay to wash clothes and dishes together. After washing, others can use them as well. Only 1 or 2 persons from the house should take food and other supplies to the patient. It's better for a young, healthy person to do this task and minimize the interaction with elderly people and those with medical conditions such as diabetes. Everyone at home should wash hands with soap and water frequently, especially after visiting the sick or touching their clothes and utensils, after using the bathroom, before cooking and eating, and when coming home from outside. You should also use a hand sanitizer with at least 60% alcohol for hand washing.
Dr. R., what should we do if we were exposed to someone with COVID?
People living in the house and others who were exposed to COVID need to take precautions as they might be infected with the virus, as well as it may take a few days before they develop any symptoms. Being exposed means that you were within 6 feet distance without a mask for about 15 minutes with someone who was found to have COVID. The risk of catching and spreading the virus is much lower among those who are fully vaccinated. If you are fully vaccinated and have received your due booster dose, then after having a COVID exposure, you can still leave home and continue other regular activities. But you must keep your nose and mouth covered with a mask when around others for 10 days after your exposure, and watch carefully for any symptoms. If possible, get tested 5 days after your exposure. If you don't develop any symptoms, then return to normal routine after 10 days. If you are not fully vaccinated or have not received your due booster, then after having an exposure, you should quarantine at home for the first 5 days. Get a test done on the day 5 if possible. If you don't have any symptoms, then you can leave home if needed after 5 days, but keep a mask on when around others for a total 10 days after exposure. During those 10 days, carefully watch for any symptoms. If you get fever, cough, fatigue, sore throat, loss of taste or smell, difficulty breathing, or any other symptom, then isolate yourself at home and get tested.